Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our series called Pláticas, Latino Wellness During COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities in New Mexico and across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. We are excited to host this Facebook Live series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. I'd like to thank our strategic partner, Morehouse University School of Medicine, for helping make this series possible. Each month in 2021, NALBA will host a professional expert in public health, behavioral health, and the field of medicine, as well as advocates and community members to share their insights, their experiences, and expertise on taking care of yourself, your family, your community during COVID-19, and also about what resources are available to help. To get us started, here's how today's Plática will work. I have several questions that I will ask our panelists, who I'll introduce you here shortly, and encourage our listening audience on live Facebook to ask or comment, and I'll share those comments or questions with our panelists. And this allows us to have a conversation, which is the English word for plática in Spanish. And I'm so looking forward to today. It's great to have you all with us today. And let's begin. So I'd like to introduce our panelists, and it just does great honor to me to be able to introduce my colleagues. And we'll start with Rose Nelson, who is the Director of Behavioral Health Services for Western Sky Community Care in New Mexico. Rose holds a BA in Psychology and Spanish and an MA in Counseling Educational Psychology from New Mexico State University. So go Aggies. She's an independently licensed mental health counselor and has worked in behavioral health for 15 years. Rose is a first-generation American, born and raised in New Mexico. She is absolutely passionate about family and the importance of access to behavioral health care for all. And so, Rose, it's so good to have you here with us today. So I'm going to introduce our other colleague, Mari Jimenez, who has 7 years experience in crisis intervention, and in 2006 received a certificate of recognition from the City of Las Cruces for developing Kid Talk, a warm line for kids in Dona Ana County. She has worked for 12 years with individuals with mental illness and received the Hero and Superhero Award for implementing a training for parents of children with behavioral health needs. After working for 8 years as a family support specialist, she was promoted to manager over the peer support team and has provided support and guidance to a team of peer supports and community health workers, and currently is the manager of the member connections team at Western Sky Community Care. She was raised in New Mexico. Mari is married and a mother of 2 daughters with several grandchildren. She holds a social work degree from New Mexico State University and is a nationally certified family specialist. So we have 2 incredible professionals, New Mexicans who are passionate about their work, and it just excites me to have them both here. And we're going to get started. We have a ton of dialogue and conversation to have, and so we're going to start with a question for both of you. And Rose, we'll start with you. And the first question is, tell us a little bit more about your background and what your work at Western Sky Community Care entails. And please go ahead.
Wonderful. Thank you, Fred, for having us. I'm so happy to be here with your organization, the National Latino Behavioral Health Association. Such a wonderful organization that we've partnered with a few times now, and so happy to be with you again today. And I do want to say also, I'm very honored to work daily with Mari, my colleague, who's also here with me. So a little bit about me. So I, again, born and raised in New Mexico. I love our state. I love our people. I am a first-generation American. My parents were immigrants from Mexico. I was raised by my mom, a single parent after my father passed away in a work accident, so very unexpected. that, that caused a lot of hardship and struggle. But, I want to connect my story to why I'm so passionate about behavioral health and also access to care and my position at Western Skies. So the way I want to do that is, I grew up with my older sister and myself, and my mom trying to do her best to make sure our basic needs were met. And in doing so, looking for all the resources she could to make sure that that happened. One of those was Medicaid, right? Accessing Medicaid for her children to make sure that we had our medical and all of our needs met. So that then she could put that aside and say, what else is important? And what she emphasized when she did that was education. Every day, la educación. ¿Qué quieres hacer en tu carrera? Always and every day. I can remember that when I was 5, right? It never ended, it never stopped. It was the most important thing to her. And the American dream, this is not new to, I'm sure, anybody on this call today, to have a better life for your children and then generations to come. So she emphasized that. She made sure our basic needs were met, and Medicaid was a key piece to that. And so as you stated in my bio, I graduated from NMSU, yep, go Aggies, with a bachelor's and master's degree focused on behavioral health care, which I'm very passionate about because through those struggles, my family struggled through depression and anxiety because it was a very difficult life situation with her being a single mom, only speaking Spanish, and then also for my older sister and I, having to grow up extremely fast, having to translate, in doctor's offices and banks, different places you wouldn't expect a child to have to, to have to deal with. But we did it, and we grew from it, and it made us stronger. And I just want to make sure that families in New Mexico understand what Medicaid can provide and support to families, because it did it for mine. So my position is exciting, and I love it because I get to advocate for behavioral health care for our New Mexican families. So that's truly why I do it and why I'm excited to be here today. Thank you.
Oh, wonderful. Oh, absolutely. Well, thank you. And I really love the way you articulated your lived experience, your life, right? And what it looks like, because in fact, for many New Mexicans, that's exactly what our lives look like. And, but it's so telling about, our values, your family's belief, your mom's encouragement, how it inspired you, and you really took that path and that advice to heart. And now you're in a leadership role, and you get to inspire and influence others. And Rose, I think your ability to mentor young students and to help others to do what you are really advocating about, is protecting our kids and doing what's necessary for them. And families are the cornerstone of Latino communities. And so, Rose, it's so good to have you here. And I'm going to turn to Mari. And Mari, so now you get to tell us a little bit more, right? Not only did it say hero, but it says hero and superhero. So all I can say is I'm already envisioning you with a cape. Right. But tell us a little bit more about you.
Okay, so my story is kind of similar to Rose. My mother immigrated from Guadalajara when she married my father at the age of 14. He was from El Paso. She quickly became a mother to 3 children, and unfortunately was divorced by the age of 20. Being left in a country where she knew very little about and limited English speaking skills, she struggled to provide for the 3 children. We were very tiny. I was barely born. And so, but she never gave up. That's what she instilled with us, to work, to look at how we could rise above every situation that came before us. She was a very hard worker, and that instilled in me and my brothers and sisters to keep going. We didn't always have the best. We were on food stamps and Medicaid also, although, and this is where I become very passionate about. She struggled for a long time not knowing these services existed. Okay, so she had to provide for the 3 children as she could, ironing, washing, babysitting, whatever she could. but she went to go on, and she got a job and succeeded. So this is what I instill in my own children and everyone that I work with. It doesn't matter where you came from. It's what you take from that to move forward. And this is part of what I do here at Western Sky and what I've done in the process. You know, when I developed Kid Talk, it was after the aftermath of the baby Brianna tragedy. And we had to find an outlook for kids. And it was very interesting. It's a wonderful story, pretty lengthy. I won't go into every detail, but the community really came together and we developed Kid Talk. And the phone number is 636-3636. Very easy to for a child to remember. And it went on, you know, and still functioning today. And I'm very proud of it because it is under La Piñon Race Crisis Center here in Las Cruces. I am in Las Cruces. I'm based in Las Cruces. I also went to NMSU later in life and received my bachelor's of social work, and I'm very proud of it. Through that education, I struggled and, you know, working and doing it all as a mother, as a wife, and all the hats that I wear, but it is possible. And that's what I share with everybody that I supervise. You know, we do have challenges, we do have things happen, but you know, we can't let that identify who we are. So we can take from that, those challenges and struggles to learn to rise above it. So later on, I came to work in managed care and I became one of the first family specialists certified in New Mexico. And to this day, there's only 2 of us here in New Mexico certified nationally. That is quite an intensive test, something like being on the licensure test, but it is possible. And so here I am at Western Sky leading a fabulous team. They're amazing to work with. They have that passion to help others. And so I'm very happy to be reporting to Rose. We sometimes finish our own sentences, you know, because we have that same burden to lead the teams and help members, help our community. Our team is very involved in the community. Due to COVID, we're not as much, but we're starting to venture out. But it's a wonderful place to be, and I'm so fortunate to be here. And thank you, Fred, for having me. I am very, very proud to be here.
Oh gosh, yeah, it's just a treat for me, of course, and for Nalba, because you get to share a little bit about your experiences today. So just if I can, I wanted to say, yeah, when I read that you're a nationally certified family specialist, I says, okay, New Mexico, I don't think has such a program.
No,
but
under the
the fact that
Federation
you're
of Family.
yeah, if you're nationally certified, boy, you really know how to really engage with families effectively to not only pass that exam, but to have such a title. So congratulations on that. So now I can see why you're like a hero and a superhero on top of everything else, you know. But I did take notice of something, my friends, and that is the fact that you're wearing green ribbons. And I'd like you to say a little something about that, because when I first saw it, I realized, gosh, that's the disadvantage of being colorblind. Is you really, I said, what color is that? I kind of was a little puzzled for a second, but I'll have you tell folks what this is, because May is a special month, right? So Rose, you want to say something about the green ribbons?
Oh, I would love to. Thank you for prompting that. Yes, these are our green ribbons here that Mari and I are wearing, and they are representative of May being Mental Health Awareness Month, which we want to scream at the top of the rooftops. It's really important for us to make sure that people feel safe and encouraged to talk about mental health to anybody they feel safe talking to. And we can add to the Facebook chat the New Mexico Crisis Access Line information and the NMCal Peer to Peer Warm Line for a resource that anybody can access. It's a wonderful resource that we often refer our members to for support. And going back to why we wear the green ribbon, we want to be representative of someone that's willing to listen to anybody and everybody that is wanting to share something about their mental health experience or asking for help. It's really important for us to put this out there in a way that it's normal, that it moves away from being stigma and being something normal that people talk about, so that we can share and help each other. It's really the only way we know what we're going through, right? As people to people, I can guess how someone is feeling, but unless they let me know, as a counselor, I know very well, you know, building that rapport and engaging people is how they share things with you. So at Western Sky, it's very important that our members feel that way. Mari's team is an amazing team. Our care coordinators, our member service staff, we're all trained in mental health first aid, motivational interviewing. It's really important to have people share how they're doing so that we can help support them. So this is not only in what we do at Western Sky, but day to day. You know, if I wear this ribbon at a supermarket and someone says, what is that? What is that for? I get to talk about Mental Health Awareness Month, right? So it's the perfect cue to share it with anybody and everybody. So that's why I'm wearing the ribbon, and I'll allow Mari to share a little bit about why she wears her ribbon.
So this ribbon represents mental health awareness, which we dedicate May to. This ribbon, like Rose says, gives you an opportunity to speak about it, be mental illness, and be open to somebody who needs to talk. That is the biggest thing that we could do, is be that one person that somebody will reach out to talk to. I mean, wherever you are, be that person that cares. We don't know what that person in front of us may be going through, but you know, it's good to ask, how are you doing? And be ready to respond, because we're so used to say, oh, we're doing fine, but we're not always doing fine. But be more inquisitive, pay more attention. Our friends, our coworkers, our neighbors may be going through stuff, and we're there. And so it's just like reflecting to my mom, when the services were there, she didn't know. People don't know. We can bring awareness, and we can be that helpful person to the next person that needs it.
Yeah, well said. Yeah, no, thank you both for saying and sharing that. And you know, you're very right to the point, right? Which is a plática is a chance for people to talk to each other, and right. And the one thing about raza, right, is we love to talk to each other, right? We embrace ourselves, and then we start telling, you know, our situation to each other. So that happens to us very naturally, right? You know, we're actually perfect for extending our support and our empathy to others, because the first question that always opens up the dialogue is, how are you? ¿Cómo estás? Right? Mm-hmm. And then, and if you ever noticed, if you ever wanted to watch a person's response, just look at their eyes, right? And their eyes will tell you a little bit without their even saying a word. But yeah, thank you for sharing the importance of Mental Health Awareness Month, and you know, the importance of addressing this issue, which you do year round, right? We commemorate this month in that way, but your work is every day, many hours a day, every week, 365 days a year. So that leads me to my second question about the work you do at Western Sky, because part in big measure, this last year and a half has been unlike any year and a half I've seen in a very long time, as all of us have, right, in New Mexico and across the nation. And there you have been really helping address these issues in the community. Share with us, tell us a little bit about the efforts that Western Sky has been undertaking to help address really what has been an incredible impact on people's lives, right? Our well-being, our mental health. You know, we all are familiar with the worrying that people have had, the isolation. You know, we're out of our natural rhythm, you know, with the way we do things, and we're very sociable people, right? So what happens is it's really had an effect on us. And I'm going to have to learn how to re-socialize a little bit, you know, with people in person, because, you know, I can't show up in my traditional COVID attire, but no, but tell us, and we'd love to hear what you've been doing. And it's really important for us to inform and educate the community, because not only have you been doing it, you're doing it now and will continue to do it, and how people can, tap into some of those resources and information.
Yeah, that'll be great. I'll be glad to share. And then, of course, Mari, please piggyback on anything I'm sharing that needs more detail. So our team, we have an amazing team, obviously way larger than Mari and myself. And we have a wonderful marketing team. And really, you hear marketing and it's like, oh, that doesn't, connect to what I'm about to talk about. But you'll see that our marketing team is really our advocacy team for spreading the word, right? That's really what marketing is, to get the word out there. And so the way that they have led our company in ensuring that we're helping our members and partnering with our community connections, our community partners, these examples will help you see why I'm saying that, right? Why they're true advocates for our members. So one of the most amazing partnerships we have that we've created prior to the pandemic, but really we're creative and innovative about how do we keep this partnership going and continue to help New Mexicans, has been with the New Mexico United soccer team. And if anybody's gone to see one of those games, it is one of the most exciting things you'll do in New Mexico. So I recommend you absolutely do that. It's phenomenal what they do. But our partnership, we have many things we're doing with them, but one of the main things that we do is we have an initiative called Get a Shot, Get a Ticket. So getting your vaccine shot, if members participated during this initiative, they also got a ticket to the game. We have a Western Sky corner where we have seats for Western Sky members that get their vaccine through this initiative. And this is to promote people getting their vaccine, to ensure their health and all of New Mexicans' health, right? And so that's one partnership that we've come together with New Mexico United, and we're very proud of that. Another thing that we did was we partnered with the Department of Health hotline. So the Department of Health set up a hotline for all New Mexicans to call with COVID questions, right? Because we all had so many. And then it was overwhelming to know where to go look for information. So there was a New Mexico Department of Health hotline set up, and Western Sky volunteered our member services team to not only take our usual Western Sky member calls, but all of New Mexicans' calls about the COVID vaccine. So we volunteered staff, and they were able to take Department of Health calls through our normal lines. And they supported all of New Mexicans with COVID questions to ensure that they knew where to go to get the vaccine, and to answer questions because there's a lot of misinformation out there that may cause someone to say, I don't want to get the vaccine, that I'm scared, or I don't know the answer to that. And so we were able to help educate and provide information about vaccine questions, age ranges, where to go, even provide assistance with how to get transportation to get there. Right, so removing all barriers to ensure that our members are as healthy as possible during this pandemic. And then another one I want to highlight, because it really does highlight like the different areas, is food insecurity. So food insecurity is a reality in our state. I think we're all aware of that. And during the pandemic, it increased. It was even a bigger problem and an issue for all New Mexicans. So what we did is we partnered, again, with the Department of Health, but also the Kellogg Foundation. And we were able to, I'm trying to see my notes here because I know the areas, Taos, Cuesta, and Peñasco. We helped provide vaccines, right? So set up an area where vaccines can be given, but also people could pick up groceries, free groceries at the time that they were getting their vaccines, so that they could take care of those two very important basic needs during that one initiative that we partnered with those community partners with. So we try to be creative. We try to address the needs that we're aware of, food insecurities, information and education. And then if you really think about it, fun, because that New Mexico United game really gives our members and New Mexicans a reason to smile and laugh, right? And we need that. So we don't want to ignore that very important basic need to have fun sometimes, even when things are scary and stressful. So there's
Okay.
so much more, but I would take the whole time. So Mari, do you want to add anything else?
Yes, of course. One thing that we have learned, and even to today, there's people that don't have insurance. We have on our website how to enroll for Medicaid. And so anybody can go onto the website to fill out an application and get information. Another thing that the Member Connection team does is conduct extensive outreach to members. During the pandemic, especially in the beginning, there was a lot of people with fear and they wouldn't even venture out of their homes. They didn't have food to eat. They didn't have utilities. And so the staff would help connect them with resources in the community, you know, because like I said, one of the things is knowing where to go. That always seems to be history. We have some resources we could use a lot more, but knowing where to go, how to do it, how to get the help that they need. That's something that the Member Connections team and all our staff are very skilled at learning how to connect a member to the resources that they need. We also help them get signed up for the vaccine. We will assist them. There's members that, you know, have limited computer skills and maybe not have access to internet. So we were able to assist them to connect to the vaccine, to get vaccinated. We also provided support and reminder calls. Remember, tomorrow is your appointment. You need to be here and there, you know, for your appointment. So a lot of our members were very appreciative. They received the information where they were at home, and we reached out to them to provide this as service. But if anybody's interested in learning how to apply for Medicaid, we're also on Facebook. Western Sky has a Facebook, and we put out a lot of promotions there, a lot of announcements, things that are happening throughout the state, where we could be, that we could be of assistance, because the marketing team is out in the field conducting outreach events, health fairs. So we're approachable, meeting you know, individuals where they are, whether at home or in different areas of town.
Wow, just amazing. Just, you know, it gives me great comfort knowing that all that is happening, right? And I actually recently spoke to a promotora, and boy, she just really put it in perspective, right? Because she's really describing everything you're saying right now, right? Which is what that looks like in the communities and families and their neighborhoods, and yeah, she touched on all these very things, but it's right to your point, is the basic support of how do we ensure that our families have food to eat? How do we take care of our kids, make sure they have meals? And, you know, parents, Latino parents particularly, will make great sacrifices to ensure their kids get to eat, right? They'll forego X, Y, and Z and make sure the ABCs of food are taken care of for their kids. And, you know, the free groceries really speaks to something that impacted people, right? You're absolutely right. Food insecurity was one of the #1 issues that really affected folks who lost their jobs, lost income, and the immediate impacts are very quick. And the food banks automatically became a vital source, a lifeline for people. So I appreciate you sharing that. And I did. You actually kind of already are going to lead us to the next question when you talked about Medicaid. If you think about New Mexico before the pandemic, right, we had people in New Mexico who were enrolled in health coverage through Medicaid. It's an important program for ensuring that we take care of our health, our well-being, so that when we need to get medical services of all different types, right, Medicaid is in fact part of our safety net. So that was pre-COVID, and then comes COVID. So there's then a different need for insurance coverage, because sometimes people who were working lost coverage with their companies. And then there was the issues about being able to pay for premiums for their health insurance plans. And so tell us a little bit more about what has happened to really ensure that people can benefit from the Medicaid program that you help to manage in New Mexico, because you cover a great space in New Mexico geographically and people's lives to ensure their well-being, and kind of walk us through just very briefly about what people can do to get coverage should they need that help, and you're a resource that's available to New Mexicans, and say a little bit more about that.
Yeah, Mari, if you don't mind, I'll cover a little bit of that, and then you can go ahead and add anything else. I'll repeat a couple of things you said because I want to make sure that we captured that. And then we also hopefully put in the chat our Facebook, how to find us on Facebook, because the key piece there is what Mari mentioned. We offer 30-minute Zoom meetings because, I think I'm in the field, so I understand what Medicaid is. I understand how to apply for it, what it means when you apply for it, and all the ins and outs of that, right? It all makes sense to me. But if you're not in managed care and you're new to Medicaid, let's say the scenario you said, Fred, where I was working and I had coverage and now I'm not working and I need Medicaid, I'm not sure I know where to start with that, right? So I want to make sure that we spread the word that Western Sky does have 30-minute Zoom meetings, so super short, very clear on how to apply for Medicaid and what that means for you and your family. And those you can find on our Facebook page. Okay, so that's for anybody and everybody. You don't have to be a Western Sky member. It's just informational, and we want to educate people about this amazing and, again, wonderful resource that helps you take care of yours and your family's basic needs, which we know are the most important. And then you can move on to consider other things that are important. So I want to make sure and call that out. So that is something, Fred, that we did before the pandemic and continue to do and will continue to do, because it's really interesting how some New Mexicans aren't even aware they qualify. They don't have health insurance and they're not aware they qualify for Medicaid, so have never applied. I'll give you a population, for example. Before the pandemic, we were trying to understand who could qualify, but maybe doesn't apply all the time. College students. Many college students qualify, but do not apply, and they're not covered under their parents anymore for whatever reason. And so we identified that population and started providing education at universities about Medicaid and what it can do for you, and what it covers, and how it ensures that you take care of yourself, right? You're getting an education, you want to be healthy, both mentally, physically, and everything. So that's just an example of work we did before the pandemic, and then during the pandemic, the work continues. It's just about education and getting the word out there, and making it, how do I say, consumable, right? 30-minute Zoom meeting, anybody can join that. It's not a huge lift. But you can also call our member services line and get information. There's many ways to get the information that you're looking for, and we're happy to support anybody with that in any way that would benefit them. Mari?
So one thing that I'd like to add is today we had a member that so new to, she's never had insurance before, and she didn't know what to do. And so she came to our office and left some stuff for us. And then we reached out to her, and she, it turns out that she was in great need of some assistance. But there are individuals out there that do not have insurance. Some of our population may have limited reading skills or writing skills, and it makes it difficult for them to fill out an application. We help support them, to apply for Social Security if needed. We connect them with individuals who are certified to make that application, because that's a very important application, and it can be lengthy and confusing. There is help out there. And one thing that our teams know a lot is, where are these resources? Where can we connect you to go and say, Rose, go over here to, ACHR, they can help you there. Or go to, healthcare for the homeless, you can receive healthcare there, and they can provide you with transportation, a bus pass. There's a lot of resources out there, and this is what we try to do, is help the member to receive what they need in the vicinity that they live. We have staff all over New Mexico, so the staff are very familiar with the communities, with the culture. Culture is very big. We are very respectful of everybody's culture, And you know, we also have a benefit, you know, of a traditional healing benefit for anyone that want to partake of that. So there's a lot available, and we're willing to help, you know, anyone that needs it. And if you're not our member, we'll be glad to connect you to where you need to go.
Oh, that's beautiful. Well, you know, thank you for sharing that, Mari. It really speaks to something that I have certainly observed about, you know, Western Sky is, you know, the cultural and linguistic approaches that you use to ensure that the communities you serve really benefit from the staff that work for your organization, so that, you know, your ability to engage with people in their language, and Spanish being the largest threshold language in New Mexico. You know, you think about the percentage of Latinos in New Mexico, 47%, right? It tells you almost 1 in 5 New Mexicans are Latino. And then that means that there's going to be a commensurate number of people who are enrolled in Medicaid programs who are Latinos. And oftentimes it's the elders who are monolingual speakers, or individuals who qualify for Medicaid that might be monolingual speakers. And so it's great to see and have you share that, because it's welcoming, and people are very open and receptive to being able to talk to someone in their language, because they're more comfortable with it. They can articulate themselves clearly that way. They even have a preference for it, right? And so thank you very much for sharing that. And thank you for giving one example when you talk about traditional healing. This actually came up in a conversation I had recently, and folks were talking about the fact that that there are traditional healers in New Mexico for both Hispanic communities. That can be Guatemalan, Mexicano, Hispanos, and and then also for Asian communities, as well as for indigenous communities. So traditional healers preceded modern medicine, right? And folks naturally do that, right? They'll talk to a traditional healer in their communities, and if that's one of your added value benefits, it really recognizes the importance of what people place in terms of importance for getting help from different types of individuals, right? Because their natural support system includes counselors and faith community members and the traditional healers, because the support system is big, right? But thank you very much. So I want to move us into talking a little bit about, and we got a shout out for you, by the way, from Izzy Garcia. And Izzy has joined us before. So I want to say it's good to have you, Izzy. He listens into our program periodically, and he's giving you a shout out. So I'm going to pass that on to you. And, you know, what's important about folks learning about today is that this message, this whole session gets recorded. So we're going to replay it, and it'll get an opportunity for people to see any of the links that we have on Facebook about the resources that Western Sky has and makes available. And our job is to promote, educate, and inform the Latino community, because their wellness for us is what our mission is about. And it's also where our partnership crosses each paths, right? As we both work together in concert to do that. But if we think about right now, where we're at today in New Mexico and our well-being, what do you see for the future? What do you see happening right now that's different? We're at a different time in terms of the healthcare field, where we are with Medicaid, where we are with national policies. All that's kind of coming together, and you'll be right at the center of that. And, you know, share a little bit about what you think are the things that New Mexicans can look forward to in terms of their well-being, health coverage, the things that are coming down the pike. So New Mexicans can be informed, they can learn where to go for these resources, because in protecting our families, the one thing I've heard across the country, and certainly here in my own home state, is Latinos say, Fred, we just need more information. They want to know, right? And so if they want to know, that tells us we want to match what's available with what they learn about it, and then put them together. So tell us a little bit about what's in store for Western Sky over the next year or so, and how New Mexicans can look forward to interacting with your organization, the company.
Thank you, Fred. Go ahead, Mari.
I wanted to add is we have, value-added services. And they not only include the traditional healing benefits, but we have eyeglass repair, gym membership, boy and girls club memberships. Also, something very important is we help with GED preparation materials, tablets for home, especially during the pandemic. Families couldn't visit each other, and that isolation leads to depression, leads to general, not feeling well, and that connection with families and with loved ones is so important. We also have a program to help pregnant moms, Smart Start for Babies. We have very creative. Our marketing team is very creative, and we have virtual baby showers where our members would sign up, and we would they would attend the baby shower. They would receive a car seat and different materials, toys, diaper bags, baby bottles, and onesies, different little things that, are so expensive that, we want to make sure that this new baby, this new child coming into the world has everything that they need, that we can help provide also.
Oh my God, I have to react to that. I love that idea, by the way. The virtual baby showers,
Yes.
whoever came up with that was brilliant. So all of a sudden, everybody at Western Sky is going to be a comadre or a compadre, right? But that's exactly the point, right? Compadrazgo systems have been around for hundreds of years. So you're tapping into something that's natural in our communities, el compadrazgo. So let me tell you what that word means. Not you guys, you already know what it is, but we don't hear that word very often. But compadrazgo means compaternity. Compaternity is how we co-parent our children and our grandchildren. So the co-parenting happens between what? Parents, siblings, tias, grandparents, extended family members. We create this compaternity of many of us to do what? To take care of our kids and raise our kids jointly. We have a collective parenting plan, right? But I love that idea, the virtual baby showers, right? And I just realized, oh my God, how many baby showers you'll be attending every week? But how cool is that? And so yeah, thanks for sharing that. And I know, Rose, you were going to add a little bit to that, and I have something that came in from live Facebook that I want to share with you in just a second. So go ahead, Rose.
Okay, perfect. Thank you. And thank you, Mari, for sharing those two programs. What I want to call out is I think people think Medicaid, and of course it is a type of insurance. So they think, okay, medical behavioral care, maybe sometimes they even question, is behavioral health covered? It absolutely is covered. I want to make sure and call that out, right? Medicaid covers behavioral health services. Very important for people to know and be educated about. But, other than the whole person, the physical, the behavioral, we are very creative. So we've got the baby showers, and I would love to be anybody's comadre that's having a baby. I love babies. So Mari and I will both be the comadres for sure. But the baby showers are wonderful. Our value-added services are just super creative. The GED prep to encourage people's education, the Native American traditional healing, but we also have holistic care grants. But there are other programs we also offer in addition to the physical and behavioral health services. We have health coaches. Okay, this is in addition to going to see like your PCP or a behavioral health therapist. We have health coaches that are focused on particular chronic conditions that provide support and skill building, I guess what we'd say like a toolbox full of tools that you can access. So this would be around diabetes, right? So education around diabetes, nutrition, and just someone to call you and check in with you. Very different than going to your doctor. You want to do that as well, but it's an additional support. So we have health coaches around, again, diabetes, asthma, COPD, heart disease, weight management, and of course, depression. And they're wonderful programs that any of our members can access for free as part of their Medicaid benefit. We also have a program called My Strengths, and we highlighted this at the most recent Behavioral Health Association conference. I was very, very proud to be able to share this with the people at the conference. It is a self-help app. So for those New Mexicans, those Western Sky members that have a smartphone, a tablet, a computer, they can access this application, this app, and it helps provide self-driven coaching. You can see information about anything you want, depression, anxiety. It even covers COVID topics about anxiety, how to talk to your children. It's an amazing resource. It's free. It's for all of our members. And we also share it with our providers so they can access information to share with their members. So it's another great thing that we offer. And then lastly, and most importantly, what we've seen during the pandemic is telehealth services. You absolutely can access telehealth services through Medicaid. Here at Western Sky, we support our providers in being able to provide telehealth services, but we also have a service called Teledoc, where you can schedule a virtual appointment. So you can do this all from your house. You can schedule a virtual appointment at physical health, behavioral health, and schedule it from your house, see the doctor, therapist from your house, never leave your house, and still get the care you need for you, your children. It's a great resource, and it became very relevant during the pandemic. So Fred, really quickly to answer the big question on what's happening here, right? The pandemic has happened. What have we learned? The one most important thing we've learned is how important behavioral health is. Okay, how important it is for people to access it, to know how to get to it, whether telehealth, crisis lines, just who do they call? How do they get help? And the more we can get that information out there, the better, because that's really what the pandemic taught us. So Western Sky has done everything we can to make sure that is happening for our members and New Mexicans in general. And again, that's really one of the reasons we're here. Behavioral health is accessible. You have access to it. You can get it any day that you need it. And that's what we want everybody in New Mexico to understand.
Oh, that's awesome. Yeah, thank you for pointing these out. These are additional great examples, right? The health coaches, telehealth, teledoc, I like that. Because, it kind of says it very clearly. And you're absolutely right. So in New Mexico, the challenge we all have had is our bandwidth that we have in our communities, right? So that's a challenge for the entire system, right? Not just for one person or one community or one provider. This is a statewide issue, and I know that we're getting legislative actions to address that. And certainly we even see an effort at the national level to help build the infrastructure. It's important for the technology that helps all Americans to help do what? Get access to these services and resources. And we did get someone who wanted to remark about how you did help with those resources, by the way. So our colleague Clarissa, who joins us regularly, and hello, Clarissa. So shout out back to you. She wanted to acknowledge that when she got her second shot, her vaccine shot in Taos, she took note of the fact that Western Sky was out there giving food boxes to seniors, and she just thinks that's wonderful, right? So you're really getting at what's important to people. It's what they need. It addresses something that's immediate, and that comfort, that sense of community that comes from the work you're doing, and that people are willing and receptive to it. It creates community. So thank you for putting community and care both together, right? Because what happens, those things get separated oftentimes, right? So thank you for that. And of course, and she also says that she loved the virtual baby shower. So you may just start something big in New Mexico, right? Because our population grows for a couple of reasons. One of them is called fertility, and what's important about that is the fact that everybody loves babies. So it's like what a cool thing that is. It reminds me of something a social work colleague of mine who worked for CYFD for her entire career. She talked about they had this practice where they actually had godparents, and these were godparents that were there to help the children that were in their programs, right? To be able to have other folks serve in that role, right? And godparents, we tend to think of it in terms of a religious or spiritual dimension, which is accurate. but it's also a social function, right? The social function of how do we create that support system around people who are vulnerable or in need. And so I appreciate your describing all of that. So all I can say, this has just been such a wonderful exchange with you guys. I mean, I was taking notes down, and I want to encourage our Facebook Live audience to do a couple of things. Please take the information down that you're seeing there about the resources and the links, and please comment as well. I know you got a big shout out and a real plus about your mentorship, and also the fact that the work that you're doing in behavioral health. And I do want to just, of course, point out something that's unique to behavioral health in New Mexico. One is that now that the Affordable Care Act has ensured that behavioral health is one of the 10 essential benefits, is that absolutely all of our mental health has been impacted. And mental health really speaks to things that are situational in nature. They happen for a period of time, but they can be resolved. And the hotlines, the warm lines, the resources that you all offer, how to connect people to be able to kind of, troubleshoot and work through the issues that they're challenged with, because these situations oftentimes are temporary in nature versus other conditions that might be more long-term in nature. But being able to ensure that people can have access, telehealth is something that in rural New Mexico or along the border or in tribal communities is so essential, because what happens, you can talk to a professional who might be 3 hours away. So remember what used to be the 3-hour trip into town, the visit, the 3-hour trip back. Well, guess what? You would stay in town to do your shopping. You're literally out of pocket for that whole day. Telehealth is now making it possible for people to be in their houses, have the privacy, the confidentiality within their homes, and to get the professional help that all of us need. Yesterday we had a Plática, and one of the participants said, it's okay not to be okay. And the point was saying is they were giving themselves permission to say, I need some help. And the help, of course, is something that you offer. So I want to say thank you for that. And thank you for highlighting the importance of our spiritual and mental health and physical health. And so we're going to end with this question. So I'd like to ask you both this question. So you've been a wealth of knowledge and information. So now you get to say your parting words of wisdom, right? So I want you to leave the listening audience with something you really want to impress on them that you believe is important, and that is important for them and for their well-being. But I want each one of you to impart, something that they can take back with them. So I'm going to start with Mari, if that's okay, Mari, because I saw her, she was like ready to jump on that question. So I better ask her right away, So Mari, I'm going to ask you to just kind of say your parting words, and if you want people to contact you, encourage them to do that too, of course. But go ahead, Mari.
So here at Western Sky, the one thing that we're very proud of is that we're New Mexicans helping other New Mexicans, connect them and helping to navigate to the resources that they need. Our teams live throughout New Mexico. We're based in Roswell, Farmington, Albuquerque, different locations, so we can be there, know the community, know the culture, and help people get the services they need. Our team believes in meeting people where they are and supporting them and accessing the right care at the right place at the right time. Thank you.
Wonderful. Rose?
Thank you, Mari. Very well said. That is our company's philosophy, and I think we every day strive for that. Fred, I think what I want to share with everybody is something you've already heard me say, so I'm going to use my mom's tactic. Just keep repeating it over and over and hope it gets in there, right? That's what she used to do with us when we were young, and she actually still does. Behavioral health care is accessible. It's available to anybody that needs it. That should never be a barrier to accessing help. Listen when someone is asking for help. It may not be direct. They may not say, I need help, but you can tell if someone you care about needs it, and give them resources. A listening ear is one of the first things you can do. But then, if they need more help, the New Mexico Crisis Access Line, the peer-to-peer warm line is something all New Mexicans have access to. Use our resources. Let's help each other. Let's have New Mexico be as healthy as possible, because that should be important to all of us. This is our state. We love it. We love our people, and behavioral health is a big part of that. So that's what I will leave people with. If someone, just listen for it and help people when they need help, because it is available. That's it.
Oh, so important. I do want to share one more comment from Facebook with you, if I can. And in fact, someone acknowledged the fact that telehealth has been a miracle for them. And what does that say, right? So within our community, people are saying how they value that. And so as we can see people learning how to use it, making it more valuable, ensuring that the IT infrastructure is there, part of the state and vendors that are involved with that industry. The way it works down for people is one of the community health workers says, well, I didn't realize that I was going to have to teach people how to use the computer and how to download the links and how to do all those basic things. And so it really says that, New Mexicans want to learn and will use the resources, but how do you access them, right? Because in behavioral health particularly, I will leave you with this because it's so important to address the behavioral health in our state, in our nation, given everything we know about it. I was just reading an article, and I did a brief video presentation on Men's Health Month, which is now in June. So we're almost to hit June, right? Next week or that's right, next week. And what I learned, of course, was something that we all have been taught in behavioral health, which is that particularly men, underreport depression. So if men particularly underreport depression, now we have to remember that there are three things that particularly are very prevalent in New Mexico for Latinos: depression, anxiety, and substance use. So if we're underreporting depression, that means we have folks who are experiencing those circumstances and those symptoms. And so thank you very much for reminding folks of the importance that services are there, that they can benefit from that. And, when I see this comment about telehealth, it's very warming to remember that people have such great hope in what they can do to feel better, do better, and improve their well-being. And you've helped us to learn about how to do that, and how your organization is there to serve. And all I could say is that you're a role model for how the industry can in fact demonstrate its cultural and linguistic appropriateness, how open, receptive you are. You're representative of the state. It really represents to me, I think, the model for how do you ensure that the healthcare coverage that our families need and can benefit from can come from the organizations who are proactively doing these things. And I do, of course, want to say that if I ever get invited to a virtual baby shower, I just have to remember what it is that I should bring to it. But Rose, Mari, thank you so much. It's been such a wonderful delight to have you with us on our Pláticas here at NALBA. And we look forward to continuing our partnership to serve New Mexicans and to meet their needs. And thank you so much. Stay safe, stay healthy, and we look forward to seeing you soon. Thank you so much.
Thank you. Bye, everybody.